Well, we're here with Dr. Zhitnitsky, if I pronounce that right, in Nuys, a dentist. Hi, Dr. Zhitnitsky. Do I pronounce that right?
Yes. Hi, Helmut. How are you?
I'm doing good. Dr. Zhitnitsky, tell us a little bit. You're a dentist, and maybe to us layman people, a dentist is a dentist is a dentist is a dentist. And then again, maybe that's not totally so. Tell us a little bit your philosophy of your dental practice. Perhaps, Dr. Zhitnitsky, perhaps you tell us even how you became to become a dentist. What's the story behind that?
Well, it's quite a long story. I come from an old dental family. Yes, make it short. I come from an old dental family. Both my parents were dentists. My aunt is a dentist, so I was born into this profession. I have a private office where I've been taking care of my patients for 18 years in the same location. I specialize in general dentistry, cosmetic dentistry. I do oral sedation for people who are afraid to see the dentist. And there's a lot of them. About 85 million Americans are deadly afraid to go see the dentist. And we make their visits completely comfortable, and they don't remember a lot, and they're very relaxed.
Okay. So basically, you do a lot of, you do a whole spectrum of dentistry.
Yeah.
And you do cosmetic dentistry. But so what about the guy who comes in who just has a couple fillings and maybe not even, he doesn't even know he has a few fillings, but maybe that's all he has, and or something is missing. Maybe he could use a major overhaul in order to look like Julia Roberts, not Tom Cruise, but he just doesn't want to or doesn't have the money. Is he still in the right place in your practice?
Oh, absolutely. We see people like that all the time. We always present a treatment that we think the patient should have. And it's up to the patient to decide whether they want to have all of it, none of it, or some of it. Well, the patient is always in charge.
All right. But you do emphasize, because I'm sure there's a difference between, let's just say I do need a car to go to work, but frankly, even a slightly beat up elder car would do the trick, so I don't necessarily need a Maserati for it. So nevertheless, I need a car. Becomes a necessity. I'm sure there's some dentistry which is much more necessity than other type of dentistry. And when you talk to patients, are you emphasizing so that it doesn't look to them like it's all like a red car or a blue car or Maserati or Ferrari or Toyota, because, that's kind of okay, like or don't like, but there must be some areas of dentistry where, look, you better do this, otherwise. Are you emphasizing on that also?
Oh, absolutely. What a lot of people are not aware of is that because dentists are sort of different type of doctors, people think that your mouth is not related to your general health. In fact, it's a part of your body that has to be taken care of. A lot of bacteria in the mouth that cause gum disease also cause heart attacks and strokes, and that has to be controlled. People who have problems chewing, people who have problems with their jaw joint, may have debilitating illness if it's not taken care of. So we emphasize general health and well-being of our patients.
Wonderful. Okay. Well, that sounds great. Very informative. And I'm sure it should give people listening and watching this video a good idea of what you're doing. I have one more question. We both seem to be living in the same part of the country. How come you have such a nice, beautiful color and I look so pale on this thing?
It must be my... It's because you're an Austrian.
Oh, I see. We're pale in comparison to the rest of the world. I got it. Thank you very much. Dr. Zhitnitsky, thank you very much. I'll speak to you more.